All right, today we're going to talk about disabled children and disabled adult children. My name is Ed Weir, I'm former manager of the Social Security Administration. I ran the third busiest Social Security office in the country, and before that, I worked for the Department of Social Services, doing Medicaid, food stamps, and all that. And many, many moons ago, Sergeant in the Marine Corps. I've done over 600 videos on all things Social Security, Medicare, Medicaid, the disability survivor benefits on my YouTube channel. I do a live Q&A many times a week. I think I'm at my 100th, over 100-day straight doing these. But Autism Oklahoma reached out to me, Dee and Melinda there, and they said, hey, we need a video for disabled children, particularly with autism. And I said, absolutely, let's do it. So they sent me a list of questions, and I've added some in there myself on all things disabled child for the parents to see if we can help you out in terms of Social Security, Medicaid, Medicare, and all the rest of it. So I am just going to go through the entire list and see how we can help you out. All right, so disabled adult child, disabled child, we're going to talk about Social Security, Medicare, Medicaid, and all the rest of it. Kind of an overview of the system. SSI is Supplemental Security Income. It's a welfare-based program that Social Security took over 50 years ago this year. And it's a needs-based income, limited resources, limited income. And then there's SSDI, Social Security Disability Insurance. That's the actual Social Security disability that you pay into when you pay FICA for all those decades. And then Medicare is a federal program that you sign up for at Social Security. That's the Part A and the Part B. And that's also what you pay for when you pay your FICA taxes. FICA goes into Social Security and Medicare. Medicaid is a state administered, comes with federal funds, but it's a state administered program for low income, low resources health insurance. And you can have Medicare and Medicaid and all the rest of it together. So let's talk about disability, particularly for children. So in order for children to get benefits from their parents, so their parents have to be receiving some type of Social Security benefits, whether it's retirement benefits or disability benefits, or if they have a deceased parent, then they can receive survivor benefits. And in order to receive those benefits, the child has to be under 18 years old, or if they're still in high school, the benefits can continue until they're graduated high school, or 19 and 2 months, or that they became disabled before the age of 22. So if the child is disabled, they can file for child disability benefits, not on the record because they're already going to be receiving benefits under the age of 18. But this is usually for SSI, child disability benefits for SSI. DAC, disabled adult child benefits, is the benefits that the child can receive from the parent. Again, one of the parents is receiving retirement, disability, or it's a survivor claim. And that is for the children, again, that became disabled after the age of 22. And usually what happens if you have a child that is disabled and you file for benefits at 16, 17 years old, and you go ahead and get that child disability benefit, and then when the child turns 18, they switch it from there to a disabled adult child. And there's usually, it should be easier than it is, but unfortunately they have to kind of go through the medical because there's different criteria for disabled children versus disabled adult children. So unfortunately, you still kind of have to go through the process. And how do you go through the process of getting a disability claim approved? You have to file the claim, and then that also includes the medical portion. So the local Social Security office asks you about, what doctors, prescriptions, why this person is, disabled and unable to work. Social Security defines disability as the inability to work now or in the future. So then they get all that together and they send it up to a state agency called the DDS, Disability Determination Services. And those are the people that make the medical determination. You don't need to provide medical records or anything like that necessarily. You just provide the names of the doctors and the clinics and the hospitals, and the DDS, the state agency, reaches out to those places and gets medical records directly. And then they look at all the medical records and see if the disability is going to be approved or not. In terms of denials, if you're denied, and this is one thing I want to kind of end on the internet. There's an internet myth that everybody's denied disability for the first time. No, I think that was started by lawyers that want you to hire them to help you and also get that money. The first two stages, the initial disability claim and then the reconsideration, you can get a lawyer if you want to. I recommend you don't, because it's easy and you're just answering the questions that a disability lawyer would ask anyway. And if you do it yourself, you save yourself $7,000 plus. So you've got the initial stage, and unfortunately right now it takes 6 to 9 months. So Social Security is at a very low staffing level, the lowest they've been in 50 years. So unfortunately it takes at least 6 to 9 months to get a decision. Once you get the initial decision, if it's a denial, then you can file a reconsideration, SSA 561. Very easy. It takes like 10 minutes to fill out, submit that, and then it will go back to the DDS, and another person in that agency will look at it and see if the first one made a correct decision. If you're denied there, then it's called the administrative law judge. It's a hearing. And that's the level I would definitely get a lawyer. I would get a local lawyer that does local Social Security disability. That way they know the judges and the doctors and everything like that. I'd definitely find somebody local. But that's the process. And I've done several videos on more details of that process. One of the questions I was asked is encourage children to work, under 18, over 18, whatever the case may be. Yeah, absolutely. I'm going to get into the details of work and Social Security here in a second, but yeah, I think it's always good for everybody to go out there and fulfilling and meet people and socialize and all the rest of it. But yes, there are certain things you need to be aware of when you work and collect Social Security benefits, but I'll get there in a little bit. All right, SSI. So the supplemental security income, people are asking about in terms of helping the children with food or rent or something like that. There's just been a change within the last 6 months. So this is August 2024, and within the last many months, Social Security has made a change. This is called ISM, Income Support and Maintenance. That if you're helping someone on SSI with food, they used to really count that against that person and they would get less SSI. For this year, the maximum SSI you can receive is $943. Some states subsidize that. I know California and some other states give you a little bit extra, but that's a state benefit. SSI in terms of Social Security, $943. And that changes a little bit every year. Never enough, but it does change a little bit every year. So the ISM for food, they don't count against it as much as they used to. So that's an extra benefit going forward. That's going to help a lot of people. And rent starting in September next month. Before, if you were helping someone, with their rent or putting them in one of your places and not charging them, that was considered kind of a subsidy, and therefore it was taken away from that person's SSI benefit. That is also being changed effective next month, and a lot of people are going to get a lot more money because of that change. All right, in terms of work, you can work and collect SSI. I did a longer video on working on SSI and a longer video with more details on working on disability, Social Security disability insurance. When you work and receive SSI, then obviously, because SSI is a welfare-based benefit, then your income from that work is offset to a certain extent from your SSI. So you always have to make sure anytime you work, you have to notify Social Security of that work, and that way they can offset your SSI amount. If you delay And unfortunately, what happens is a lot of people report on time, but because Social Security is so understaffed, they delay putting the information into the computer, and then your children gets benefits for 1 or 2 or 3 months when they shouldn't have gotten that much. And then there's an overpayment situation, which don't sweat the overpayment. I've done a bunch of videos on overpayments. One thing I want to talk about. So I've got a whole list of questions here. I'm going to continue going through the list. If you have other questions, make sure you put them in chat. And if anybody else out there, again, this is not only for autism, this is for any children in the United States, children or a disabled adult children that needs the help. Put your questions in there. And if I see something, I will make another video and add this onto this one, or a little short little video, and answer 1 or 2 or 3 questions of people that have. So I will continue to update this. This will be the basic video. And then in the description down below in YouTube, I'll put updates on there. So, and I have a big favor to ask. So this is not only for Oklahoma, this is for the entire country. So local resources throughout the country. If you have resources in Florida or Kansas or New Hampshire, whatever the case may be, please put it into the chat, or excuse me, into the description down below. And that way we can help as many people out as we possibly can. Okay, so ISM for rent, that's going to help a lot of people next month when that new change goes into effect. The food, not as much, the offset doesn't happen as much. SSI, you can work, but you have to make sure you notify. Social Security, SSDI, the Social Security Disability Insurance. So if the child is receiving SSDI based on, again, the parent's record, or if they're disabled themselves, because the child can, so if you have a child that's 25 years old, became disabled, they can receive SSDI on their own record. So not only on the record of one of their parents, also a step parent. A child can receive benefits from a step parent as long as married, and one half of support comes from that step parent. Work for SSDI, bit different. I wish it was less complicated, but here we go. A lot of acronyms. For work and SSDI, you have what's called the trial work period. So for 9 months, you can make $1 billion a month. Doesn't matter. You have a trial work period for 9 months, and it doesn't have to be consecutive. It could be, a month here and a few months there. But the total 9 months, you're allowed to make as much as you want. And there's a trigger month. So there are what's called the substantial gainful activity, and any month you go over the substantial gainful activity, they just might stop your benefits. But in terms of the trial work period, like this year, the SGA, the substantial gainful activity, is $1,550. The trigger month for the trial work period is different. This year, it's $1,110. So anytime you go over $1,110 for this year, that starts the trial work period. So if you're under that amount, then you're good. So if your child is, making $1,000, a little bit under, I always recommend stay under it. Don't go right to the 1110. Don't go right to the 1550, whatever the SGA is. That's kind of a red flag for anybody, not only disabled children, but anybody that's receiving disability, because that's kind of a red flag, because Social Security looks at it and says, well, this person is working, $1,549 every single month. And, they're really timing their work. So sometimes that triggers what's called a CDR, which I missed on the last one. So a CDR is a continuing disability review. When you are receiving Social Security disability benefits, every now and then, depending when they make the decision on what you're going to receive from disability, they also make a decision on your diary date, as they call it. You're going to be your CDR, your work review, your disability review, that is, your disability review every 3 years or 5 years or 7 years to see if you're still, medically disabled. They can also do work CDRs as well, continuing disability reviews based on work. So if you do a lot of work, that will trigger a work CDR, and they will reach out to you. One thing I want to caution you on, or Actually, the opposite is, please don't overly stress about CDRs, the continuing disability reviews. It's a budget-driven process. Sure, you have one every 3 years or 5 years or 7 years, whatever the case may be, but sometimes you'll get it, sometimes you don't. Social Security offices throughout the country, I know this because I ran the third busiest one in the country, and these are based, and SSI RZs, redeterminations, are based on a budget that Congress gives Social Security. So CDRs and SSI, redeterminations are based on a budget. If the office doesn't, if your local office doesn't have a budget, they can't do it. But what happens with CDRs is if they have a quota to do 100 for that month, they got to do 100 that month, or their boss gets angry, and their boss gets angry because Congress gets angry. Why didn't you spend the money we gave you to, ensure the trust fund is still there? So what happens is offices, in order to make sure they receive 100, they send out like 200 packages. So if you're part of that extra 100, then unfortunately, you waste all your time filling all that information out. And what makes it worse is people stress about having to do that. And so just if you get one of these continuing disability reviews, fill it out, make copies, return it, and please forget it. Just forget it. And if they contact you with some other information, then, fill it out again. But there's a good chance that nothing will ever happen. So yeah, it's an unfortunate system that really stresses people out, but that's the reality. Okay, so let's get back to work here. Working trial work period, 9 months, not necessarily consecutive, make as much as you want. After you fulfilled that 9-month trial work period, you go into what's called the extended period of eligibility, EPE. And that's a 36-month time frame. And any month that the person on disability makes over the substantial gainful activity, SGA, this year, the 1550, any month they go over the 1550, they're not entitled to those benefits, and that check should stop. But again, reporting that is important, and Social Security actually inputting into the system is even more important. And sometimes either one of those don't happen, and you get an overpayment. And don't worry about the overpayment. Come back, watch my videos on overpayments. Come back during my live Q&A and say, "Hey, Ed, I just got a letter for an overpayment. What do I do?" And we'll walk you through the entire thing. All right. Some people, again, were asking about, okay, should I encourage my child to work, adult child to work? Again, yeah, always, if they're able to. And if their disability stops because of that work, well, number one is if they're receiving SSDI, and you get Medicare from SSDI, Social Security Disability Insurance, just like you get it from retirement benefits and spouse benefits and survivor benefits. You do not get SSI from, excuse me, you do not get Medicare from SSI because SSI is a welfare-based program, and that's not part of, FICA. But if you're on SSI, you probably can, most definitely can get Medicaid from the state. But in terms of if you're getting SSDI, the child is getting SSDI based on a parent's record, work record, or surviving benefits, or whatever the case may be, and they work, and their benefits stop after a certain time, after they fulfilled the trial work period, after they fulfilled the EP or whatever the case may be, but their benefits stopped because of work, then their Medicare can actually continue for like 96 months. So a lot of people say, "Oh, I don't want them to work because they'll make more money working, but then their Medicare will stop." No, if their SSDI stopped because of work, Social Security assumes that the reason the disabled person was able to work is because they had health care to enable them to work. And Social Security always wants people to go back to work. It's good for them. It's good for the country. It's good for the trust fund and all that rest of that stuff. So, but they want to make sure you have health care going forward. So Medicare almost always continues. So don't worry about that. However, if the person goes back to work and then their benefits stop, but within 5 years they just can't do it anymore. they tried their best. They went through their trial work period. They went through some months of their extended period of eligibility, and then Social Security finally just shut down the benefits because of the work. Um, Within a 5-year period of your last check, you can file for what's called an EXR, an expedited reinstatement. That tried my best, worked and worked for a year, 2 years, 5 years, but I'm just not able to do it anymore because of the same disability. It has to be the same disability, and your check had to stop because of work. Not, some people, they get an operation or something and their disability stops because they're no longer disabled. So that doesn't count. It has to be your disability benefits stopped because of work, and it's the same disability. So within 5 years, you just go back into Social Security, you file that EXR, expedited reinstatement, and you just say, yeah, I tried my best. It just didn't work, and I want to go ahead and restart my benefits. And they will, even though it's called expedited reinstatement, there's nothing expedited about anything in Social Security. Unfortunately, they go through the whole process. But they can give you provisional payments while you're waiting. So you can say, yeah, I want to restart my benefits, and so Social Security employee can say, well, do you want money, next month start? And so they can give you provisional payments. All right. Then there's this thing called the unsuccessful work attempt. If you're working while you're, waiting for your disability approved or something like that, which, because Social Security disability takes so long to get approved, some people, have to go back to work. But if you go back to work for a month or two and just not able to do it anymore, the Social Security employee can write that off as an unsuccessful work attempt, and that won't necessarily affect your disability claim. All right. And in terms of helping you go back to work, there is the Ticket to Work, which is a private organization that Social Security contracts with, that you call the Ticket to Work, and they help you kind of navigate the system a little bit and try to find you kind of, work, rehabilitation, help you find work, come up with plans and stuff like that. So that's a free service that you can reach out to Ticket to Work. And a lot of people don't know there's called AWICS, Area Work Incentives Coordinator. Each area in the country, the whole country of Social Security, there's over 1,500 offices. Each area is broken up to 9 different regions, and there's different areas within each region. And each area has a Social Security employee that's been designated to be the expert on work incentives, helping people go back to work and explaining, like I just did, the trial work period and the EPE and the EXRs and all that kind of stuff, to make sure you're doing the right thing. So definitely reach out to them. Unfortunately, people don't know about them and they don't reach out to them, and so they get kind of messed up. And keep notes. Anytime you talk to a Social Security employee, go down, your local 99-cent store, get a cheap little notebook, and say, on August 17th, 2023, 2024, 2025, I talked to John at the local office, and I told them that I just faxed in, the pay stubs. I just did this, and, whatever the case may be. And that way you've got a running note of it. Anytime you hand in copies, make copies. Or the best thing is go down to local Social Security office, hand them your original documents. They will make copies, stamp it, initial it, and give those back to you. And that way you got documentation that you actually did the right thing. Always keep notes and always keep receipts. All right. In terms of Medicare, again, once somebody is approved for disability insurance, their Medicare starts in 24 months. There's some exceptions for Lou Gehrig's disease and ESRD, end-stage renal disease, but everything else you have to wait for 24 months, and then your 25th month, your Medicare starts that month. And that's Part A and Part B. If the child, or anybody has health insurance from work, you do not have to sign up for Part B. If you're getting money, then Part A is automatic, which Part A is, zero premium per month for most people. For Part B this year is $174.70. But if the child or the adult has anybody on disability, or if you're 65 years old, same exact situation when you're 65. If you have health insurance from current work, yours or your spouse's, and the employer has 20 or more employees, you do not need to sign up for Part B. save yourself $174. And then when you stop work in the future, or stop receiving health insurance from work in the future, you have technically 8 months to sign up. I wouldn't recommend 8 months. About a month or so before you know you're going to lose your insurance, go ahead and sign up for Part B, add A or B or whatever. And then that way, when one day your health insurance stops from work, then the next day your Medicare picks up. And the Medicare Part A and Part B are great, but there's a lot of gaps. The big one is in Part B, you have to pay 20%. So if you have a $100,000 operation, Medicare will pay $80,000, but you have to cough up the other $20,000. So that's why people either get a Medicare supplement plan. Those are the ones in the plan, Medicare supplement or Medigap, same thing, Plan G or Plan N, or a Medicare Advantage plan. Unfortunately, in most states, if you're under 65, then those health insurance companies know that you're on disability, and therefore you're going to cost a lot more for health issues. So they have worked with the states, paid the politicians to make sure they don't have to provide Medicare supplements for those people. So long story short, if you're under 65, depends on your state, but it's probably going to be very, very difficult, if not impossible, or very expensive to get a Medicare supplement plan. So you'll probably have to get a Medicare Advantage plan. But if you get a Medicare Advantage plan, once you turn 65, you can switch to a Medicare supplement plan, and there's no medical underwriting or anything like that. So if the child has Medicare and low income, low resources, they can also go to the state and apply for Medicaid. So they go to the state and apply for Medicaid and ask then the state to pay for their Part B premium. So the state will look at it, and if they put them in the correct level, there's called the QMB and the QI and there's SLIMB. Every state is a little bit different, but if they put them in one of those categories, they just might pay for the Part B premium. So it is possible for a child to receive SSI, SSDI, Medicare, and Medicaid. All four of those. That is possible. How is that? If a child is receiving SSDI from a parent's record or even their own, because they worked a little bit, paid in the 10 years or whatever, let's say their SSDI is $500 a month. Remember, SSI is $943 a month. So they can get SSDI, get their $500 check, and then add that other $443 for a total of $943. So they're receiving SSDI and SSI. And because they're receiving SSDI, they're eligible for Medicare. And because they're only receiving $943, they're also eligible to take their SSI eligibility and go down to Medicaid and become what's called categorically eligible for Medicaid. So they can have, again, SSDI, SSI, Medicare, Medicaid, and then get the Medicare Savings Program to pay for the Part B premium, and they get a Medicare Advantage plan because now they're receiving Medicare and Medicaid. It's called the dual eligible Medicare Advantage plan. Those are the crazy ones you see advertised, which they are correct. They advertise in kind of a scammy way, but those are the ones that get, the electricity help and all these extra benefits, dental, vision, hearing, depending on your particular area, and they change every single year. All right, what are some of the other questions? Remember, put your questions and remarks down there, I will continue to add to this video and talk about things in more detail or add things you want me to add. What about divorced parents? The question was. Divorced parents, same type of situation, no issue. The child can receive benefits on a divorced or whatever the case may be if that person passes away. How much are we talking about here? If, let's say, the parent is receiving retirement benefits, they're 62, they just start their benefits at 62, when they file for benefits at 62 years old, then they say, I have a child under the age of 18, or I have a child that became disabled before the age of 22. And then the claim specialist at Social Security also takes a claim for the child. And because the parent is still alive and kicking, they will receive 50% of that parent's PIA, which is the primary insurance amount, which is the amount you would have received if you waited until your full retirement age. So they'll receive 50% of that. but there's also called the family max. So if you have a disabled child, but you have two other children, there's a maximum that Social Security can pay out to that immediate family. So they'll do that calculation at that time. And when you file, and again, this is for, as soon as you file for retirement benefits, or if you are 55 years old and you file for disability benefits and you're entitled to benefits based on disability, your children are entitled to benefits if they're under the age of 18 or they became disabled before the age of 22. And it's the same 50% of your primary insurance amount. A surviving child can receive 75% of that parent's primary insurance amount. So when if the child is receiving benefits from the parent and the parent was receiving retirement or disability, whatever the case may be, 50%, when the parent passes away, it will automatically convert from a living claim to a death claim, and it will automatically go from 50% to 75%, and that's automatic. At the same time you file, so let's say you walk into the office at 62, 63, 64, 65, and you file for retirement benefits on your own claim. They ask you about the children, you tell them about your child, you go ahead and take that claim. You also need to do a representative payee application. So the representative pay application is if the child is able to take care of their own benefits, you say, oh, no, they've got limitations, but they like taking care of their own benefits, so you can have them take care of their own benefits. But if you want to take care of it, then you file a representative pay application, and you're ultimately responsible to make sure those benefits go for their welfare. And a lot of people are stressed out about, there's an annual payee report that you get. So every year, if you're the representative payee for a child, you'll get a payee report, and it'll say, hey, we sent this child, this adult child or whoever, $15,000 last year. What did you do with it? And if you're the natural parent, just fill it out and return it. There's a lot of laws and regulations about these payee reports and everything, and those are usually for institutions and foster situations and adoption, different stuff that Social Security is kind of watching out for to make sure the benefits go for their welfare. But if you're the natural parent, you just put roof over their head, food in their mouth, bottom of PlayStation. That's it. Send it in and forget about it. So it's not a big deal. Don't sweat it. If you're the natural parent or a step parent, no issues whatsoever. There are what's called ABLE accounts. So if the child or anybody is receiving SSI, a welfare-based program, SSI, Medicaid, there is limited resources, and sometimes people on disability need to save up a little bit for some type of thing that they need, a new car for their disability, home improvements or something like that. So they're saving up this money to do something, good for their disability, but that counts against them in terms of SSI and Medicaid. Luckily, a few years ago, there was a law passed called the ABLE law, and it's an ABLE account. So you can just go ahead and Google it online, and there's limitations. They're in the midst of changing the regulations now to increase the age you could contribute to that ABLE account. So, but if you got someone gives you $50,000 to, upgrade your home for your disability, your SSI and Medicaid probably won't stop if you put it into this ABLE account and use it for those approved resources. So definitely check that out. I think I've covered everything. And as I mentioned, I've got this free live Q&A. I do 3 o'clock West Coast time on YouTube and 6 o'clock East Coast time. I've done it every day for the last 100 days. I think I missed one day. But I'm going to keep doing it. This is my new mission, and my semi-retirement is to make sure you all get the benefits you're entitled to and help you navigate the bureaucracy. So you can join me on one of those, and I usually talk about a topic of the day, and then I open it up for live Q&A. And I'll also have a private call thing, which I kind of have to charge for. It pays for everything else. But anyway, but most of the questions I can help you with on the live Q&A. And then I also did a video that, let me go ahead and pop it up here. on how to live on Social Security alone. I've taken all my decades of experience working in Social Security and Medicaid and welfare and all that, and I've kind of consolidated them down into that video. There's over 40 different programs, ideas to save you some money, make your life easier, you and your children. And watch that. I did a 4-part series. The introduction was way too long. I'm doing this YouTube stuff, so I'm kind of terrible at it. But anyway, but this is an updated and expanded one. The 4-part series goes into more detail on a lot of those, but hopefully you can find something in there that makes your life easier. And the 2 checks one is, a lot of people miss. Yes, you can get 2 checks. As I mentioned, anybody, you can get, retirement benefits, and you can get spouse benefits. You can get disability benefits and surviving spouse benefits. You can get Social Security disability insurance and SSI. So they're essentially 2 different checks because they come from 2 different programs or another person's work record or whatever the case may be. And a lot of people miss those separate benefits. Yes, they do come in the same check, the same pay date, same direct deposit and stuff, but they're essentially 2 checks, 2 different benefits. In the old days, they would have essentially come in 2 checks because they're 2 different benefits. But now they're consolidated into one, and therefore people think, no, you can't get a second benefit. Yes, you can. If you're on disability, you can get survivor benefits. If you're on, yeah. So watch the video on that, and it goes through all of the details. All right, I think I got it all. So if you have any questions, make sure you put it down in the remarks down there. Join me on my live Q&A, and if I get more questions, I will do another video, do some shorts, and I will tag it in the description down below. And thank you to Autism Oklahoma, Dee and Melinda, for reaching out to me and telling me to do a video like this. I like it. More community support is always welcome. And that's it. Y'all have yourself an awesome day. Take care, and we'll talk to you soon.